As surgeries for lymphedema and lipedema become more popular and more effective, I'm super excited to start this series of videos on the surgical options that are currently available to patients and the results that are seen. I do this with the understanding that procedures are constantly being updated, modified, changed, improved, etc., so we have to keep that in mind. It's also important to mention that proper patient selection for a particular procedure is truly of utmost importance. Most medical teams are continuing to perfect this process, but if the right patient isn't selected for the right surgery, it will not be successful. Today's study is entitled, Does Liposuction for Lymphedema Worsen Lymphatic Injury? And this is an amazing topic as it's something I'm asked all the time. So I was really excited to see when Dr. Chen and his colleagues published this study in 2023. Dr. Chen acknowledges the effectiveness of this time-tested surgical intervention, but he also acknowledges the fear that patients have, probably as well as clinicians, about lymphatic damage with these surgeries. So liposuction for lymphedema is utilized in order to remove the fatty tissue fibrosis that occurs with long-standing fluid within a limb. This study included 41 patients who had 57 affected limbs. Patients had either primary or secondary lymphedema, and both upper extremities and lower extremity surgeries were performed. Lymphedema was measured using tape measure as well as ICG or indocyanine green testing in order to identify reference points, lymphatic channels, and dermal backflow. Upper extremities were treated in full during the surgeries, and lower extremity surgeries were broken down into two parts, the thigh or upper leg, and then the lower leg was typically a separate surgery. Surgery was performed using the tumescent liposuction technique, which involves injecting fluid with an anesthetic into the limb. This helps with pain, this helps with identifying the proper tissue, and it also uses a microcannula or a much smaller cannula versus traditional liposections. And all subjects in this study also went excessive skin excision as well. Patients were compressed for 1 month following surgery with short stretch bandages. And this continued with daily changes in the bandages and rewrapping by the patient. At 1 to 2 months post-operative, patients were transitioned into a custom 30 to 40 millimeter of mercury garment. Follow-up measurements showed improvements in limb size and the lymphatic system itself. These changes started as early as 3 months with progressive and continuous improvement throughout the entire course of the study. At 6 months, 6 limbs actually showed new, previously non-visualized lymphatic channels, which continued to evolve beyond 1 year. So not only doesn't damage, but actually improves the lymphatic system. Dr. Chen hypothesizes that these new lymphatic channels may be useful in building LVAs for future surgical interventions if needed. This study clearly shows that there was absolutely no worsening of lymphatic drainage or the lymphatic system following liposuction, and that there's actually evidence of improved lymphatic drainage with ICG lymphography over time. And remember, the time course of this study was 2 years. So this is not a fast process. Improvement of dermal backflow patterns were seen with downstaging and again, improved lymphographic changes, suggesting improvement of lymph transit itself. You can just see the visual improvements here in this photo. Full details of the study can be found in the link below. I hope you found this information useful. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist. My goal is to make us all lymph smart.